Hello everyone. Today's session is on pharmacokinetic part 2. So it includes mainly metabolism and excretion of drug. Okay, so metabolism. It is also called biotransformation. So it means transformation of drug in biological tissue. So which are the site where metabolize can occur? So metabolism can occur at liver, kidney, intestine, lungs or plasma. The main site is liver. Most of the drugs are metabolized in liver. Okay. Now what happened because of metabolism of biotransformation? So biotransformation leads to inactivation of drugs, active metabolite of active drugs, activation of inactive drugs या फिर toxic metabolite produced from active drugs. So four things can happen: inactivation of drugs, active metabolite forms from the active drug, activation of inactive drugs या फिर toxic metabolite formation from active drugs. So most of the drugs are goes to inactivation by process of biotransformation. Okay, some of the drugs convert to active metabolite from active drug, like codeine convert to morphine, digitoxin convert to digoxin. Some drug produce toxic metabolite from the active drug, like paracetamol convert to NaBQI and isoniazid convert to acetyl hydrazine. And some of the drugs forms active metabolites from inactive drugs. Drugs like prednisone convert to prednisolone, levodopa convert to dopamine, and enalapril convert to enalaprillate. So this part in which drugs forms active from the inactive drugs, it is called prodrug, which ultimately convert to active drugs. So which are the advantage of this type of prodrugs? Which drugs is inactive but it produces active metabolite. So advantage is it is more stable, better bioavailability and desired pharmacokinetic properties, and less side effect and less toxicity in this type of prodrugs. So these four things can happen because of biotransformation: inactivation of the drug, active metabolite formation from the active drug, activation of the inactive drugs which is called prodrug, या फिर toxic metabolite production from the active drugs. Okay, now which are the reactions? Metabolism reaction या फिर biotransformation reactions. Mainly two phase 1 and phase 2. In phase 1, the name is non-synthetic functionalization reactions. In phase 2, the name is synthetic conjugation reactions. So phase 1 include the reactions like oxidation, reduction, hydrolysis, cyclization and decyclization. And phase 2 include the reactions like glucuronide conjugation, acetylation, methylation, sulfate conjugation, glycine conjugation, glutathione conjugation, ribonucleoside या nucleotide synthesis. So these are the main reactions through which drug is metabolized. Phase 1 non-synthetic functionalization process, phase 2 synthetic conjugation reaction. Phase 1 include oxidation, reduction, hydrolysis, cyclization, decyclization. Phase 2 includes glucuronide conjugation, acetylation, methylation, sulfate conjugation, glycine conjugation, glutathione conjugation and nucleoside synthesis. So let's see the phase 1 reactions and their enzymes and example of drug which metabolize through these reactions. So phase 1, first one is oxidation. In oxidation what happened? Addition of oxygen or negative radical or deletion of hydrogen या फिर positive radicals, means oxygen addition and deletion of hydrogen. It is called oxidation reactions. Enzyme involved in this process is monooxygenase and cytochrome 450 enzymes. And examples are most of the drugs metabolized by this reaction. Second reaction of phase 2 is reduction, in which Exit of oxidation means deletion of oxygen and addition of hydrogen, opposite of oxidation. Enzyme involved for this process is cytochrome 450 enzymes, and examples are alcohol, aldehydes, and quinones. Third reaction of phase 1 is hydrolysis, in which addition of H2O occur. Enzymes involved for this is esterase, amidase, and peptidase. Example of this reaction are cholinesterase, lignocaine, aspirin, oxytocin. These drugs are metabolized by this reaction. Cyclization, in which formation of ring structure can occur. Example is enzyme involved is cyclase, and example of drugs is proguanil. Decyclization, in which opening of ring structure occur. Enzyme for this process is decyclase, and drugs which metabolize by this reaction is barbiturate and phenytoin. So mainly these 5 reactions occur in phase 1: oxidation, reduction, hydrolysis, cyclization, decyclization, with different enzyme involvement and with different drugs examples. Now phase 2. Okay, which are the cytochrome 450 enzymes? So CYP 3A4, CYP3A5, CYP2D6, CYP2C8, CYP2C9, CYP2C19, CYP1A, and CYP2E1. These are the main cytochrome 450 enzymes which are responsible for mainly phase 1 reactions. Okay, now phase 2. Which are the phase 2 reactions through which a drug can metabolize? So first one is glucuronide conjugation. Enzyme responsible for this reaction is UDP glucuronidase transferase, and group which are conjugated by this is hydroxyl and carboxylic acid. And drugs which metabolize by this process is aspirin, diazepam, and metronidazole. Okay, second reaction is acetylation. Enzyme responsible for this reaction is acetyl-CoA. Groups conjugated by this process is amino and hydrazine. An example of drug which metabolized by acetylation is sulfonamide, isoniazid, para-aminosalicylic acid, and Dapsone. Third reaction of phase 2 is methylation. Enzyme responsible for this is methyl transferase. Groups which conjugated by this is amine and phenols. And examples of drugs which metabolize by methylation is adrenaline, histamine, and methyl dopa. Sulfate conjugation. Enzyme responsible for is sulfotransferase. Groups conjugated is phenolic and steroid. And drugs which metabolize by sulfate conjugation is adrenal and sex hormones. Glycine conjugation. Group conjugated is carboxylic acid, and example of drug is salicylate and nicotinic acid. Glutathione conjugation. Enzyme involved for this process is glutathione S transferase, and group conjugated is quinone epoxide, and drug is paracetamol metabolized by this process. Ribonucleoside या nucleotide conjugation. Groups are purine and pyrimidine conjugated through this process. Example is cancer chemotherapeutic drug metabolized by this process. So these are the phase 2 reactions, and there are different enzyme for that, and example of drug which metabolize by these reactions like glucuronide conjugation, acetylation, methylation, sulfate conjugation, glycine conjugation, glutathione conjugation, and ribonucleoside nucleotide conjugation. So these are the mainly phase 1 and phase 2 reactions which are responsible for different type of metabolism of different type of drugs. Okay, now enzymes. So enzymes can be microsomal enzyme or non-microsomal enzymes. So where it can be located? So microsomal enzyme located in smooth endoplasmic reticulum of liver, kidney, intestine, lungs. While non-microsomal enzymes mainly located in cytoplasm and mitochondria of hepatic cell and other tissue and plasma. Responsible function. So microsomal enzyme mainly responsible for all the phase 1 reaction and glucuronide conjugation of phase 2. And non-microsomal enzyme mainly responsible for all the phase 2 reaction except glucuronide conjugation, which is occur by phase 1 with microsomal enzymes. Induction. So microsomal enzymes are inducible while non-microsomal enzymes are non-inducible but shows the genetic variation. So this is the difference. What is microsomal enzyme, non-microsomal enzyme, where it can be located, which reaction caused by this enzyme. So mainly microsomal responsible for phase 1 and glucuronide conjugation, and non-microsomal for the phase 2 except glucuronide conjugation. Microsomal are inducible, non-microsomal are non-inducible. Okay, one short question. Hoffman elimination. So inactivation of drug in the body fluid by spontaneous rearrangement without use of enzyme. Means drugs inactive होगी because of some type of rearrangement but without use of any enzyme. It is called Hoffman elimination. Example is atracurium. Inactivation of drug in the body by spontaneous rearrangement without use of enzyme. Example is atracurium. It is called Hoffman elimination. Okay. Now, which are the factors responsible for this biotransformation process? So, mainly physiological factors, chemical factors, and altered physiological states like pregnancy, hormonal imbalance, disease state, temporal factors like circadian rhythm. Okay, so these are the factors which affect the biotransformation or metabolism. Physiochemical property of the drugs means it depends on drugs. Chemical factors like induction of drug metabolizing enzyme, inhibition of drug metabolizing enzyme, या फिर environmental chemicals. These are the chemical factors. Biological factors like species and strain, age and sex, and diet. This also can affect the metabolism of drug. Altered physiological state like in pregnancy, in hormonal imbalance, या फिर in some type of disease, it can affect the drug biotransformation. And temporal factors like circadian rhythm. So these are the main factors which affect the metabolism or biotransformation of the drug. Physical property, chemical factor, biological factor, physiological state, and temporal factor. But the main two factors are induction of drug metabolizing enzyme या फिर inhibition of the drug metabolizing enzyme. So let's see induction. So enzyme induction. What happened in this? So induction of the enzyme activity by one drug. So it increase the metabolism of other drugs or sometimes same drugs. Means एक ड्रग एंजाइम इंडक्ट करती है कि जो अल्टीमेटली मेटाबोलाइज करती है दूसरे ड्रग को. तो एक ड्रग दूसरी ड्रग का मेटाबॉलिज्म इंक्रीज करती है थ्रू इंक्रीज ऑफ एंजाइम इंडक्शन प्रोसेस. So one drug is increase the metabolism of other drugs. So it occur gradually over 1 to 2 week period. Now what is the significance of this? Enzyme induction का importance क्या है? So it is responsible for the drug-drug interactions like contraceptive failure. When we give rifampicin plus phenytoin, it inhibits the action of OC pill because phenytoin and rifampicin both are enzyme inducer. So it induces the enzymes which increase the metabolism of OC pill. OC pills means oral contraceptive pills. So because of increased metabolism of oral contraceptive pills, the action of OC pills is not occur. So contraception is fail. So you have to remember this reaction. Rifampicin plus phenytoin is induce the enzymes which ultimately increase the metabolism of OC pill. So contraceptive failure occur. Second one is warfarin require higher dose if given along with enzyme inducer barbiturates. So barbiturates is enzyme inducer. It induces the enzyme which increase the metabolism of warfarin. So when you are giving barbiturates with warfarin, you should give high dose of warfarin because barbiturate increase the metabolism of warfarin. So effect of warfarin going to less. So you have to give high dose of warfarin. Third one is barbiturates induce its own metabolism. So it given for the longer time. So when you are giving barbiturates, it induces its own metabolism. So at every time effect is going to decrease. So patient develop tolerance. So every time you have to give barbiturates for the long time. So these are the main type of drug-drug interaction which is clinically significant for the enzyme induction. You have to keep in mind which are the drug-drug interaction because of enzyme induction. Okay. Second significance is it can produce the toxicity like paracetamol toxicity occur in chronic alcoholic patient. Third one is therapeutic utilization of enzyme induction. What is the use of enzyme induction? So to treat the neonatal jaundice, phenobarbital induce the fetal hepatic glucuronidal transferase enzyme which ultimately metabolize the bilirubin. So phenobarbital is a drug which is mainly enzyme inducer. It includes the enzymes which enzyme glucuronidal transferase कि जो एंजाइम इंक्रीज करता था मेटाबॉलिज्म ऑफ बिलीरुबिन. सो अल्टीमेटली बिलीरुबिन का मेटाबॉलिज्म इंक्रीज होगा तो लेवल ऑफ बिलीरुबिन इज गोइंग टू डाउन इन बॉडी. सो बिलीरुबिन डाउन होगा तो जॉन्डिस ऑटोमेटिक रिकवर होगा. सो ये है मेनली थेरेप्यूटिक यूटिलाइजेशन ऑफ एंजाइम इंडक्शन. न्यूनेटल जॉन्डिस होगा पेशेंट को, अब फेनोबार्बिटॉन दोगे तो it increase the enzyme, induce the metabolism of bilirubin, so jaundice is going to resolve. So these are the some clinical significance point of enzyme induction, drug-drug interaction, toxicity and utilization of enzyme induction. Now enzyme inhibition. Okay, so here same opposition of enzyme induction. Inhibition of the enzyme activity of one drug leads to increase the level of other drug and produce the higher plasma concentration level. Means one drug inhibit the enzyme metabolism. So one drug inhibit the metabolism of other drugs. So level of other drug, plasma concentration of other drug is going to increase. Exact opposite of induction. Enzyme inhibition means one drug inhibit the enzyme, so inhibit the metabolism of other drugs. So other drugs level in the blood or plasma is going to increase. So it is a rapid process. It can be reversible or irreversible. Now what is the significance of this enzyme inhibition? So adverse consequences can occur because of this process, like increased bleeding tendency with decumerol when given with cimetidine. So cimetidine is enzyme inhibitor. So cimetidine inhibit the enzyme which metabolize the decumerol. So decumerol का metabolism कम होगा, बॉडी में decumerol का लेवल इंक्रीज होगा, so chance of increase the bleeding tendency. Second example is severe respiratory depression with morphine when given with monoamine oxidase inhibitor. So MAO inhibitor are enzyme inhibitors. It inhibits the metabolism of morphine. So level of morphine is increased. So morphine causes the more severe respiratory depression. So these are the two adverse consequences can occur because of this type of enzyme inhibition. Okay, what is the beneficial action of this enzyme inhibition? So increase accessibility of levodopa in brain when given with carbidopa. So carbidopa is enzyme inhibitors. So carbidopa inhibit the enzyme which metabolize the levodopa. So ultimately more levodopa goes to brain and more effect of levodopa can occur. Disulfiram can be used as a de-addiction because of enzyme inhibition. Reversal of skeletal muscle paralysis due to D-cubicularine by the neostigmine. So these are the beneficial reactions. So this is enzyme inhibition on its significance. So you have to remember what is enzyme induction means one drug induce the enzyme, so decrease effect of other drug. Enzyme inhibition, one drug inhibit the enzyme, so increase the level of other drugs. And what is enzyme inhibition and induction, and what is that clinical significance? So here the completion of metabolism. So you have to remember what is metabolism or biotransformation, which are the sites where metabolism can occur, which are the transformation reaction phase 1 and phase 2, which are the enzyme responsible for phase 1 and which are the drugs example which metabolize by phase 1, which are the enzyme responsible for phase 2 and which drugs are metabolized through phase 2, and factors affecting biotransformation, and main two factor enzyme inhibition and enzyme induction and their clinical significance. Okay, now last part of pharmacokinetic is excretion. So what is excretion? So excretion is defined as the process where drugs and their metabolites are irreversible transferred from internal to external environment. Means drugs or its metabolites are goes from our body to external environment irreversible. It is called excretion. So which are the site from where drugs can excrete from our body? So through urine, through hepatobiliary system, through feces, through air, through milk, through saliva, through sweat, through skin, through tears, through hair. These are the main sites from which drugs can excrete from our body. Okay, so let's see kidney or renal excretion. The main excretion system of our body is renal excretion. So three processes can occur. First process is glomerular filtration. So all the non-protein bound drug present to glomerular filters, okay, and it filters through this part. Depends upon the renal blood flow and plasma protein binding. Means blood flow अगर ज़्यादा होगा, प्लाज्मा प्रोटीन बाइंडिंग नहीं होगी तो उसका फिल्ट्रेशन ज़्यादा होगा. GFR decrease after the age of 50. So after the age of 50 years, glomerular filtration of drug is going to decrease. So this is called glomerular filtration. Mainly non-protein bound drug filtered through this process, this pathway. It's mainly depend on renal blood flow and protein binding. and GFR it decreases after age of 50 years. Second process through which drug is excreted is tubular reabsorption. Okay, what is it? So about 99% of filtrates are reabsorbed through this process. So what going to filtrate through glomerular filtration are going to reabsorb from this process. Depends upon the lipid solubility and ionization potential of the drug at the existing urinary pH. So tubular reabsorption is mainly depend on lipid solubility and ionization of drug. So it is useful in poisoning. Suppose in patient have poisoning acidic drugs like salicylate and barbiturates, then if we are going to do alkalinization of urine, then these type of drugs are mainly reabsorbed in the tubule and excreted through kidney. If poisoned by basic drugs like morphine and amphetamine, if we give going to do acidification of urine, then this type of drug is mainly reabsorbed in the tubule and going to excrete through kidney. So this concept tubular reabsorption is responsible or useful in the poisoning case. If basic drug, then we have to do acidification of urine. If acidic drug of poisoning, then we have to do alkalization of the urine. So tubular reabsorption, 99% of the drug are reabsorbed, mainly depends on lipid solubility and ionization. Importance is poison by acidic drugs, alkalinization of urine do, poisoning by basic drug, then you can do acidification of the urine. So in this type of poisoning, this process is useful. Third process through which renal excretion of the drug occurs is tubular secretion. So if the clearance of drug is more than 120 milli per minute, then drugs can be actively secretion in the tubules. Protein binding is not hindrance for tubular secretion like in glomerular filtration. Main two type of transporter are responsible for this tubular secretion. For the acidic drug, organic anion transporting peptide OATP, organic anion transporting peptide. For the basic drug, organic cation transporting peptide. So these two transporter OATP and OCT are responsible for tubular secretion of the drugs. Other transporters are also present like P-glycoprotein. It is also responsible for tubular secretion. Drug utilizing the same active transporter compete with each other. If two drugs are going to exit through this process and transporter is same, then they can compete with each other. So which is the example? So penicillin and probenecid can compete for excretion. Sulfenpyrrozine inhibits the excretion of tolbutamide. Salicylate blocks the uricosuric action of probenecid. These are the example of competition through same transporter. Penicillin and probenecid, sulfenpyrrozine with tolbutamide, and salicylate with probenecid. Okay, so these are the main three processes in tubular renal secretion. Renal secretion of the drug or renal excretion of the drug can occur through GFR, glomerular filtration, tubular reabsorption, and tubular secretion. Main three processes through which drug is excreted through kidney. Okay, other organ for the excretion is hepatobiliary system and feces. So, drug which not absorbed in the gut are secreted through bile and excreted in feces. Same transporter like in kidney. In intestine also there is same transporter. OATP means organic anion transporter peptide, organic cation transporting, and P-glycoprotein are responsible for the transport of the drug. Larger molecule are mainly excreted in the bile. So this is liver hepatic transporters. Now, what is enterohepatic circulation? Drug which exit through bile can be reabsorbed and then again enter into the liver, like digitoxin, indomethacin, morphine, rifampicin. These are the example of enterohepatic circulation of drug. It increases the duration of action of ultimately that drug. So it is called enterohepatic circulation. Means drug exits through bile, again reabsorb and again goes to the liver. So ultimately increase the action of that type of drug. So this is hepatobiliary excretion of the drug and fecal excretion of the drug. Other route is air. Through air, through lungs also drug can excrete. Like gas and volatile liquids are excreted through air or lungs. Example are general anesthetics and alcohol. Alveolar transfer of the gas mainly depend on the partial pressure of blood. So this is excretion through air or lungs. Other is milk. So it is important for the nursing infant. Lipid soluble and non-protein bound drugs mainly excrete through milk through process of simple diffusion. Milk pH is slightly acidic, so concentrate mainly basic drugs. So this is excretion through milk. Other route is saliva and sweat. You have to remember the examples like lithium iodides and phenytoin are excreted through saliva, and rifampicin excreted through sweat or tears. So these are the different routes through which drugs can excrete. Main is the kidney or renal, other is the liver, feces, air, milk, saliva and sweat. Okay, now let's see what is kinetic of elimination, what clearance, how the drug is cleared through our body. So what is clearance? So theoretically, volume of plasma from which drug is completely removed in unit time, it is called clearance. Means plasma volume from drug is completely removed in specific unit of time, it is called clearance. Let's see the example. So clearance is equal to rate of elimination upon plasma concentration. Means plasma concentration में से कितनी drug eliminate हुई in unit time. So suppose the patient have elimination rate of 500 microgram per minute and concentration is 10 microgram per ml. So clearance would be 50 ml per minute. So you have to remember the formula. Clearance is equal to rate of elimination upon plasma concentration. Okay. Now what is kinetics? So first order kinetic, so in which constant fraction of drug is excreted from our body. Constant fraction means suppose 50% excretion, so every time 50% is excreted. Suppose 25%, so every time, every hour 25% is excreted. Most of the drugs follow this type of kinetics. Suppose you can see in the example, in x-axis there is a plasma time, in y-axis there is a plasma concentration. So 5 unit per hour elimination rate. After 1 hour, 2.5 unit per hour. After 1 hour, 1.25 units per hour. Means every time the concentration going to be same percentage, 50%, from 5 to 2.5, 2.5 to 1.25. मतलब 50% is excreted. Means constant fraction of the drug is every time excreted in specific unit of time. Second kinetic is zero order kinetic. So in zero order kinetic, constant amount of drug is excreted. So here constant amount means suppose in first time 50, then in every hour 50, 50, 50, same, not 50 to 25 to 12.5. Suppose let's see the example. You can see 2.5 unit per hour, then after 1 hour same 2.5 unit per hour, after 1 hour same 2.5 unit per hour. Means amount is constant. So this is called zero order kinetic. You have to remember, in first order constant fraction is elimination, and in zero order constant amount of drug is elimination. Most of the drug follow the first order kinetics. Some of the drugs like alcohol and phenytoin are follow the zero order kinetics. So फर्स्ट ऑर्डर काइनेटिक में कांस्टेंट फ्रैक्शन होगा, परसेंटेज कांस्टेंट हो गए 50% 50% या 25% 25%. जीरो ऑर्डर में अमाउंट कांस्टेंट होगी 2.5 तो 2.5 2.5 सेम. Second one, another definition, important definition is half life. What is plasma half life? इसको बोलते हैं T half, T 1/2, T half. So it is time taken for the plasma concentration of the drug to reduce to half of initial value. मतलब ड्रग्स का प्लाज्मा में कंसंट्रेशन कब हाफ होता है, इनिशियल से हाफ होने का टाइम. इट इज टाइम टेकन फॉर प्लाज्मा कंसंट्रेशन ड्रग टू रिड्यूस टू हाफ टू इनिशियल वैल्यू. इनिशियल वैल्यू से हाफ कब होता है, इसको बोलते हैं हाफ लाइफ. सो 4 to 5 हाफ लाइफ इज रिक्वायर्ड टू कंप्लीट एक्सक्रीशन ऑफ द, मतलब ड्रग को बॉडी में से कंप्लीट एक्सक्रीट करने के लिए 4 to 5 हाफ लाइफ चाहिए. सो सपोज फर्स्ट हाफ लाइफ मीन्स सपोज 100% कंसंट्रेशन था, तो आफ्टर फर्स्ट हाफ लाइफ 50% होगा. उसके बाद सेकंड हाफ लाइफ में उसका भी 50%, मतलब 75% ड्रग एक्सक्रीट हो गई. थर्ड हाफ लाइफ में 87.5% ड्रग एक्सक्रीट हो जाती है. आफ्टर फोर्थ हाफ लाइफ अराउंड 93% ड्रग एक्सक्रीट होता है, एंड आफ्टर 5 ऑलमोस्ट ऑल द ड्रग going to exert through our body. So mainly 4 to 5 half life is required for complete excretion of the drug. Every time 50% is excreted. You can see first time 50%, second time then further 50%, so 50 plus 25, third time 50 plus 25 plus 12.5, fourth time 50 plus 25 plus 12.5 is 6.25. So ultimately after 4 to 5 half life almost all the drugs going to eliminate from the body. So plasma half life means time taken for plasma concentration to reduce to half from its initial value. Okay, half life remain constant in first order kinetic. Means first order kinetic में क्या होता है, every time constant fraction, constant percentage is going to eliminate. So half life is constant. So what is the difference between first order and zero order kinetic. So first order kinetic half life is constant या फिर unchanged. In zero order kinetic every time half life is going to increase. Okay, what happened to elimination if doses increase? If we are going to doses increase in first order, then elimination is increased because constant fraction of the drug is eliminated. So if we are going to increase the dose, then increase the elimination occur because of constant fraction is going to eliminate. In zero order kinetic, if we increase the dose, there is no change in elimination. Means because of constant amount is fixed. The same amount going to exit. If you are going to increase the dose, there is no change in zero order kinetics. Dose increment. So first order kinetic dose increment should be same as initial dose, and in zero order kinetic dose increment should be smaller than initial dose. Competitive inhibition can occur in first order kinetic, rarely occur in first order kinetic, but common in zero order kinetic because of saturation of enzyme. Example, so most of the drugs follow the first order kinetic. Some of the drugs like phenytoin and alcohol is follow the zero order kinetic. So you have to remember the difference. What is first order kinetic and zero order kinetic, and what is effect of plasma of life, elimination process, dose increment, inhibition, and which are the example which follow the zero order and first order kinetic. These are the some short question or example for the first order and zero order kinetics. Okay, so here we complete our lecture. So let's fastly revise. So we have already seen absorption and distribution. What is pharmacokinetic? ADME, absorption, distribution, metabolism, and excretion. We have already seen absorption and distribution in last lecture, and we have already seen today's lecture metabolism and excretion. So metabolism, so second name is biotransformation, which is the site from which metabolism can occur. What happened because of biotransformation? What is prodrug? Example of prodrug. Reaction in biotransformation, which are the reaction in phase 1, which are the example of phase 2 reactions. Detail of reactions, which are the enzyme responsible for phase 1 reaction, which are the drugs metabolized by phase 1 reaction, which are the enzymes responsible for phase 2 reaction, which are the examples of drugs which metabolize by phase 2 reactions. Enzyme classification, which are the microsomal enzyme, non-microsomal enzyme, which is responsible for this type of reaction, phase 1 or phase 2. Hoffman elimination short question, which are the factors can affect the metabolism of drugs. Okay, main two factors are enzyme induction and inhibition. What is induction? So increase the metabolism of other drugs. What is inhibition? Increase the level of other drugs, inhibit the metabolism of other drugs. दोनों का इंपॉर्टेंस क्या है, सिग्निफिकेंस क्या है, एंजाइम इंडक्शन का क्या है, ड्रग ड्रग इंटरेक्शन, कौन से डिजीज में यूज होता है एंजाइम इंडक्शन प्रोसेस, व्हाट इज एंजाइम इनिबिशन, उसके साइड इफेक्ट्स क्या है और इसके बेनिफिशियल रिएक्शंस क्या है एंजाइम इनिबिशन की. देन एक्सक्रीशन, व्हाट इज एक्सक्रीशन, कौन सी साइड से ड्रग एक्सक्रीट हो सकती है, मेनली किडनी में कौन सी 3 प्रोसेस से ड्रग एक्सक्रीट हो सकती है, तो GFR, रीएब्सॉर्प्शन एंड ट्यूबुलर सिक्रेशन. Other organs from which drug can be excreted are hepatobiliary, renal, milk, saliva, sweat. Then short question like what is kinetic of elimination, what is clearance, formula of clearance, what is zero order kinetic, what is first order kinetic, means constant fraction, zero order means constant amount is elimination, what is half life, how much time required for complete excretion of drug, means 4 to 5 half life is required for complete excretion of the drug through body. What is the difference between the first order and zero order kinetics, and how it can affect the first order zero order kinetics, like what effect of plasma of life, what the effect of elimination if increase the dose, what is the dose increment effect, what is the example which are the example of drug which follow the first order kinetic या फिर zero order